Type 2 diabetes. You've probably heard the name before, but what does it really mean? Why is it so common today? And how does it affect the body? In this video, we'll break down type 2 diabetes in simple terms. What it is, how it develops, the risks it brings, and the impact it has on individuals and society. Let's dive in. Let's start with the basics. Our bodies run on energy, and one of the main sources of that energy is glucose, a type of sugar we get from food. When we eat, glucose enters the bloodstream. To use it as fuel, the body relies on a hormone called insulin, which acts like a key, unlocking cells so glucose can enter. But in type 2 diabetes, this system doesn't work the way it should. Either the body doesn't make enough insulin, or the cells don't respond to it properly. As a result, glucose builds up in the blood instead of fueling the cells. Over time, this leads to serious health problems. It's important to know that not all diabetes is the same. Type 1 diabetes usually begins in childhood, when the immune system destroys insulin-producing cells. People with type 1 need insulin for life. Type 2 diabetes is different. It usually develops later in life, and the body still produces insulin, at least in the beginning. But the cells don't use it effectively. This is called insulin resistance. Type 1, autoimmune, childhood, needs insulin. Type 2, resistance, adulthood, managed in different ways. Type 2 diabetes is the most common form of diabetes, about 90 to 95% of all cases worldwide. Right now, more than 500 million people live with diabetes, and that number is rising. What's even more concerning? It's no longer just an adult problem. More and more teenagers and even children are being diagnosed. Type 2 diabetes doesn't appear overnight. It develops slowly over years. First comes insulin resistance. The cells don't respond well to insulin. To keep up, the pancreas pumps out more insulin. But eventually, the pancreas can't keep pace, and insulin production begins to fall. At this point, blood sugar levels rise. Before diabetes itself, there's often a stage called prediabetes, higher than normal blood sugar, but not quite diabetes yet. Without action, this can turn into full type 2 diabetes. Who gets type 2 diabetes? There's no single cause. It's a mix of factors. Age, especially after 45. Family history and genetics. Being overweight, particularly with belly fat. A lack of physical activity. Certain ethnic backgrounds. Conditions like polycystic ovary syndrome or gestational diabetes during pregnancy. But remember, anyone can develop type 2 diabetes, even people who seem healthy. Many people don't realize they have diabetes at first, because the symptoms can be mild or gradual. Look out for these common signs: feeling thirsty all the time, needing to urinate often, unexplained weight loss, tiredness, blurred vision, slow healing cuts, tingling or numbness in the hands and feet. These symptoms can creep in slowly, which is why regular health checkups are important. So what happens if high blood sugar continues unchecked? It damages organs and blood vessels throughout the body. The heart and blood vessels face higher risks of heart attack and stroke. The kidneys may weaken, sometimes leading to kidney failure. In the eyes, tiny blood vessels can be damaged, causing vision problems and even blindness. Nerves can be harmed, creating pain, numbness, or loss of sensation, especially in the feet. The brain may also be affected, with higher risks of memory loss and dementia. Doctors diagnose type 2 diabetes using simple blood tests: the fasting glucose test, taken after not eating overnight; the oral glucose tolerance test, measuring the body's response to sugar; the A1C test, which shows average blood sugar over the past 3 months. Often, doctors also check cholesterol, blood pressure, and kidney health, since diabetes can affect all of these. Type 2 diabetes isn't just a personal health issue. It's a global challenge. Healthcare costs are enormous, from regular checkups to hospital care for complications. Families can face stress, both emotional and financial. And communities feel the impact as more people struggle with related illnesses like heart disease and kidney failure. The good news: type 2 diabetes is often preventable. By staying active, maintaining a healthy weight, and eating balanced meals, many people can lower their risk. But prevention doesn't stop with individuals. Public health programs, schools, and governments all play a role in creating healthier environments. Let's clear up a few myths. Myth 1. Only overweight people get type 2 diabetes. Not true. Anyone can develop it. Myth 2. Eating sugar alone causes diabetes. Not exactly. Diet matters, but it's about overall lifestyle and genetics too. Myth 3. Type 2 diabetes is mild. Wrong. Left unmanaged, it can cause life-threatening complications. Type 2 diabetes can affect people at any age. In children and teens, it's linked to rising obesity rates. In adults, it often develops silently, with few warning signs. In older adults, it can combine with other health problems, increasing risks of falls, infections, and memory loss. We also can't ignore the mental health side. Living with diabetes can bring stress, anxiety, or depression. At the same time, mental health struggles can make it harder to manage diabetes, creating a difficult cycle. That's why emotional support is just as important as medical care. Research is ongoing. Scientists are exploring genetics, early detection, and new ways to monitor blood sugar using technology. Public health campaigns are raising awareness. And slowly, communities are learning to create healthier spaces for future generations. Type 2 diabetes is more than just numbers on a blood test. It's a condition that affects millions of lives, families, and societies around the world. By understanding what it is, how it develops, and its impact, we can move toward healthier choices and a healthier future. Knowledge is the first step, awareness is the key, and together we can face the challenge of type 2 diabetes.